Hi, my name is Aisha Galloway Gilliam. I'm the medical director of the Comprehensive Weight Management Center at Hennepin Healthcare. My background is that I'm board certified in internal medicine, integrative medicine, and obesity medicine. And I want to talk to you a little bit about our program. We offer a really comprehensive approach to weight management. We work together as a multidisciplinary team, many team members. There are two arms to our program. One is a surgical arm and the other is our medical arm. As the medical director of the program, I oversee the medical arm. And this is really important because it helps to provide the foundation for successful weight management and health management when patients are engaged in care with us. What I mean when I talk about medical care is that there are fundamental components that involve lifestyle. And those are how we eat, how we move, how we sleep, and how we manage our stress. In addition to those items of importance, there are additional tools that we can use when our goals for our health are not met by lifestyle measures alone. And those additional tools include medication management, in addition to, as I mentioned, our surgical arm. So when a new patient comes to see us to get medical advice about how to help with their weight, and they are not interested in surgery, we see them in the medical arm of our program, and we do a really comprehensive intake assessment with the patient. We are getting information about their health journey, their weight journey, and their past medical history, and other medical conditions that may have contributed to their current state of health. After we obtain a comprehensive assessment with the patient, we share in a discussion about what the next best steps look like to help them achieve their healthcare goals. Notice that a lot of the times when I'm referring to a plan, I use healthcare. I don't focus primarily on numbers. That's a really important fundamental aspect of our program that reflects our attention to lifestyle and the benefits that can be achieved through healthy lifestyle choices, independent of the number on the scale, although the weight is obviously still important to address as well. Our program is different from other programs in that we really hone in on setting a solid foundation around lifestyle measures. In addition to using other available tools like medications and surgeries, we do understand that those tools are important and valuable to have access to, but they are not the answer. They are part of the solution. And so when we use them on a foundation of lifestyle. We do not use them independent of lifestyle measures. And that is part of why our program has been so successful in its comprehensive approach to care. Our patients feel plugged in. They feel that we are understanding them on a whole person, holistic level, and they feel that they have, and they do have, tremendous support from our multidisciplinary care team. So we are open to patients both who are coming to our program from within our own organization and also patients from the community. We have plenty of patients who seek care with us from other healthcare systems, even outside of the Twin Cities area. You don't need a referral to come and engage in care with us. We look forward to working with anyone and everyone who would like to establish a relationship with our program.
Hi, my name is Whitney. I'm a registered dietitian here at the Comprehensive Weight Management Center. As a registered dietitian, I do medical nutrition therapy, which is essentially personalized nutrition counseling to support my patients in healthy, sustainable behavior change. So prior to surgery, I work with my patients to build a solid foundation of habits and lifestyle that is really going to set them up for successful, healthy weight loss after surgery, as well as with my non-surgical patients who are focused on more of a lifestyle approach, or they're using medications to assist in weight loss. A lot of my patients ask me about what portion size they should be eating, or they come to me and they assume that I'm going to tell them what to eat and what not to eat. My approach is more patient-centered, and I really try to center their personal experience and their own relationship with food. People eat for many reasons, not just, food is fuel, food is nourishment. It is those things, of course, but it's so much more. Food is tied to our identity, our culture. Food is comfort. Food is love for many of us. Those are important factors in what we eat, why we eat, when and how we eat. So all of those are things that I discuss with my patients. One thing I really enjoy about working in this clinic is that I get to build lasting relationships with my patients, and we really get to know each other. Weight loss is not easy. It's a marathon, not a sprint.
Hi, my name is Isabel, and I am one of the registered nurses working here in the Comprehensive Weight Management Center. My role is both in the surgical support and in the medical management area. Within the surgical support side, we support the surgeons as patients are going through their process and in following up with their care. But majority of our time is spent in medical management, which is just being able to support patients as they begin medications, the GLP-1s, the GIP-1s. And what support looks like in that area is, following up, how are the patients doing on the medications? Are they noticing any negative side effects? We educate about making sure that they're eating 3 meals a day, rich in protein. We are making sure that they're staying well hydrated, because, good nutrition is the cornerstone of weight management. Patients come in having been told oftentimes by society that, it's, go and lose weight, like eat less, work out more, and you lose weight. But, weight is, it's complicated, right? It's multifaceted. So we're just able to support our patients one-on-one, depending on exactly what they need in meeting their goals. We also offer support group, and we do that once a month via Teams. The role of support group is for patients who are on different paths to weight management and weight loss, and that could be surgical, medication management, or lifestyle modifications, to just have a space to talk to each other. We are excited that you're here and that you're interested in our program. We are here to support you in your journey. We're excited to meet you, and we're here for you. Welcome.
So hi, I'm Latasha Dyer. I've dealt with my weight loss journey pretty much since I was a little kid, but it pretty much flamboyant when I got pregnant at 42 and I became 300 plus pounds. I think my highest was 318 pounds. That really pushed me to do something with my weight and my health when I had my daughter, which I named her Miracle, because I want to be here as long as I can for her. So I just told my primary care doctor to make me a referral with weight management. He did that, and when I came here, a light switch went off. I met with the internal weight management doctor, and he asked me that I exercise, and I told him, yeah. I was like, I take my daughter to daycare, and he was like, that's not exercise. So it was a light that went off, and I'm like, well, I work, I'm a nursing assistant, I've been exercising all my life, but that's not exercise. And I thought all my life I was kind of exercising, but that wasn't exercise. So he told me that he wanted me to exercise at least 20 minutes every day, and I told him I'll do him one better and do 30 minutes. So after I met with him, I just started walking every day for 30 minutes, and I've been doing that every day current, even since now I still walk. The nutritionist, my dietitian, she taught me a lot too, how to read the labels. I never read a label in my life, so that's the first thing I do now when I go in the grocery stores. I look at the added sugars or just whatever, and I go from there. And yeah, I didn't know about vegetables and protein. I didn't even know eggs was protein. So, I mean, I've learned a lot just meeting with her for them 6 months, just about food in general. So, yeah, to go to the grocery store now, I know foods are higher, but the natural stuff is what I go for. But I'm learning, and I can pass that down to my daughter. If you don't have the mindset, it's not going to work either. So you have to completely make a complete life change. Yeah, it's not just about the food. It's like everything in general. I mean, I didn't think walking would make a difference, but I walk every day and I see the difference because that's all I was doing was just walking. And people like, I didn't know you could lose weight from walking, but you can. You know, it's hard. I'm not going to say it's easy, but I've been disciplined and I'm going to stay that way.